Hello, welcome back to my YouTube channel. I'm datsweetnurse. Thank you to all our returning subscribers for sticking to our educative channel. And if you're seeing our face for the first time, please don't forget to like, to subscribe, to share, and comment on our videos. Now let's move into what we have for today. Today we'll be sharing an important topic, which is PCOS, and it's called polycystic ovarian syndrome. Now this PCOS is a problem with the hormone that affects women who are in their childbearing age. Now what is actually the cause of this PCOS? There's actually no known cause, but researches and some factors point to the fact that an increase in the male hormone to actually prevent your ovaries from producing hormones and making eggs normally. Now what can you see that will be like an indication that someone has PCOS? That is, what are the symptoms or signs of PCOS? Now we have, firstly, darkening of the skin. You can also have acne. You can have irregular periods. There can be missed periods. There can be infertility in some cases. In some cases it can be excessive hair growth, and then there can be skin tag. Now how do you know you have PCOS? Like, most especially in the hospitals, most people that come and get diagnosed of PCOS doesn't even know that they have problems with their hormones till they come to the hospital and then they get diagnosed. Like, they came with another presenting symptom and then PCOS is then being diagnosed. So if you want to know if you have PCOS, you can actually do the pelvic examination test. This will help you know if there are problems with your reproductive organs, if there are any masses, if there are any changes, and then you can do the blood test. The blood test will help you measure your hormone levels, and then finally you can do an ultrasound scan, which will help you know how your ovaries are doing, and then the thickening of the lining of your uterus. And now, what are the types of PCOS? So we have four major types of PCOS. Firstly, we have the insulin induced PCOS. Now this is when a high level of insulin prevents ovulation and causes the ovaries to produce male hormones. And then secondly, we have the pill-induced PCOS. Now this happens to people who take birth control pills. Before they started taking the pills, they had a regular period, and then after they stopped taking the pills, they now experience irregular periods and fluctuations in hormones. And then thirdly, we have inflammatory PCOS. Inflammation can actually trigger the production of the male hormone testosterone. So if you're experiencing things like joint pains, chronic headache, alongside with suppressed or irregular periods, then it can be an indication that you have PCOS. And then finally, we have the adrenal PCOS. Now for this one, this is the least common type of PCOS, and it happens when there is like an excess of adrenal androgens, and this is usually as a result of abnormal response to stress. And now, can PCOS be managed? Yes, you just need to modify your lifestyle, and actually that's lifestyle modification and diet modification are the two major things you will need to balance your hormones if you have PCOS. Now let's talk about foods that you can eat if you have PCOS. And what are the foods you can eat if you have PCOS? Now, when we talked about the management, remember we said that you have lifestyle modification and diet modification. So you agree with me that your diet influences the management of PCOS. So firstly, you have to incorporate antioxidants to your meal. Antioxidants will actually help reduce inflammation in the body. So you have to incorporate ginger and turmeric in your meals. And then secondly, you have to go for heart healthy foods. This is because heart healthy foods helps in hormone reproduction and vitamin absorption. So you have to incorporate extra virgin olive oil in your foods, or walnuts, or almonds or walnuts. You also have to incorporate the lean proteins. So lean proteins will actually help you stay full for a longer period of time, and it will aid in weight loss. And these foods about PCOS, it doesn't just speak to people who have PCOS only. Remember that your diet is also very, very important in influencing your own health as an individual. So lean proteins like skinless chicken and turkey breast should also be incorporated. And then lastly, you have to go for complex carbohydrates like the legumes, the oats, and the sweet potatoes. Now, since you know foods you can eat, it's also wise you know foods you can avoid if you have PCOS. And first on our list is unhealthy fats. Now, you see, trans fats and saturated fats actually cause inflammation in your body, and we already talked about the fact that inflammation can trigger the production of those male hormones in the body. So you need to stay away from anything that will cause inflammation. Foods like French fries, fried foods, donuts, and processed meats. And then secondly, processed foods like ice cream, cakes, and candies, you should also stay away from them. And then third on our list is alcohol. You know, alcohol poses direct toxins to your liver, and one of the lasting effects of PCOS is increased risks of fatty liver diseases. So you see, alcohol will do you no good. And then you have to stay away from refined, simple, and processed carbohydrates. This is because people with PCOS do not process sugar properly due to the high level of insulin. So you stay away from white rice, white bread, pastas, and their siblings. And then lastly, you have to stay away from all these sugar filled drinks now, or our beverages. You agree with me that most of those drinks and beverages are packed up with refined sugar, and like we said before, people with PCOS do not process sugar properly because of the high level of insulin. So you have to stay away from these sugar filled drinks and sugar filled beverages. And then because you've listened to this video, it doesn't now make you a doctor that now diagnoses PCOS. Remember that PCOS is and can only be diagnosed at the hospital. You do not see people and point fingers because you feel like you don't have the knowledge of PCOS, and then you go out there telling them things you want. Most of the signs and symptoms of PCOS are also or can also be found with other conditions. So if you feel like you're experiencing any problem with your hormones and your periods, all you have to do is go to the hospital and get yourself diagnosed. Hope you enjoyed this video. Please do not forget to like, share, and subscribe to my YouTube channel, and don't forget to turn on the notification bell to see more educative content like this. Thank you.